Welcome back to another Senior Learning Institute's educational moment, where older adults and their loved ones turn for honest and straightforward information. In just a few minutes, you'll enjoy bite-sized, easily digestible nuggets of knowledge, empowering you to make the right decision the first time. So without further ado, here's our founder, Certified Senior Advisor, Seniors Real Estate Specialist, nationally syndicated podcaster and speaker, the advocate you can trust, Mr. Ted Gottlieb.
Thank you for being a part of another Senior Learning Institute educational moment. Thanks to a Google search on quotes on wellness, I'm going to set the tone for this conversation on health and wellness. You are what you eat. Your body is a temple. Let food be thy medicine and medicine be thy food. Da Vinci said the human foot is a masterpiece of engineering and a work of art. And my favorite, before physical therapy, I was very unstable. Some would actually argue that I still am, but that's okay. We're stuck with the genes that we were born with. However, most of us can improve our health, wellness, and longevity. And that's what this seminar is designed to do, take greater control of our destiny. At this point, I'd like to have our panel of experts start by introducing themselves, and we'll start with Reshaunda.
Well, good morning. My name is Reshaunda Thornton. I am a dietitian that specializes in wellness and consulting individuals. You can easily find me at my website at reshaundathornton.com.
Thank you. Hedva?
Hi, I'm Hedva Barenholtz Levy, and I am a pharmacist who specializes in working with older adults to evaluate their drug therapy to resolve medication-related problems. And you can find more about me at my website, which is www.hblfarm.com.
Great. Krista?
Hello, my name is Krista Sieve. I'm a board-certified foot care nurse. I have my BSN, and my mission is to help people avoid surgery to resolve their foot issues.
Great. Thank you, Krista. And Beth?
Hi, my name is Dr. Beth Templin. I am board certified in geriatric physical therapy, and I am the owner of House Fit, and you can find us at housefitstl.com.
Thank you much. And I'm Ted Gottlieb. I'm a certified senior advisor and seniors real estate specialist. Reshaunda, we're going to start with you. Please tell us what a registered dietitian does and what it takes to earn those credentials.
Well, definitely. The interesting thing about being a dietitian is that there are several different hats, so different industries in which a dietitian could work in. Most dietitians that you may have seen, you see them in the hospitals or you see them in nursing homes or in food service. But dietitians, their space as far as being a nutrition expert can expand in different regions, whether it's working in a corporate space, working in media, working in literature, working in academia. And to be a dietitian, it takes a little bit of work. So I'll give you a little bit of insight of my education. So I have two bachelor degrees, one in biology and one in nutrition and dietetics. But that doesn't make me a dietitian. In order for me to be a registered dietitian, after completing my bachelor's, I have to do a 1.5-year internship where I get to really kind of gauge the scope of dietetics from interning in different areas of dietetics to understand the profession as a whole. And then I had to sit down for board tests to be licensed. And so after all of different stages, I'm licensed to work within the state that I am licensed. So I'm licensed for the state of Missouri. And so that allows me to work with individuals as far as a healthcare professional in the state of Missouri. But with being a dietitian, again, the whole goal of dietitians is to play that role in helping people to teaching and educating individuals, helping prevent disease or lessening diseases and illnesses. We're there to help the speed recovery whenever there is some sort of sickness. And we're also there just to help to maintain what healthy life is for individuals.
Great, and that's really important. So some of the things that I heard there, protecting our health, I know also preventing allergic reactions, alleviating disease symptoms, and also planning menus, right?
I mean, it's a plethora of different duties that we have, and most dietitians have that general education to be able to work in those spaces. But there's also areas where dietitians can specialize, so you can get your specialization working in being a geriatric dietitian. I am specialized also working with athletes. You can be specialized to work with diabetes. So outside of being licensed and registered, you can go into another level of specialty where it's more time, more testing, more education to help you to be more beneficial in your role. So so many different areas in which the dietitian can specialize or focus in areas of health and life.
Right. Is it fair to say that most older adults are going to run into and interact with a dietitian in either a skilled nursing facility or in rehab?
That's where you're definitely going to see a large handful of dietitians. They have to be in those spaces, because when it comes to that, at that stage of your life, you know, how are we as dietitians going to be able to provide the appropriate nutrients to give your body so it can maintain itself and so it can survive and live as long as it can? And also, typically at the latter part of our lives, that's when some of the illnesses and chronic diseases start to arise. So we really need in those spaces to help those individuals to at least live a healthy life with the time that they're here. But for myself, I can kind of like speak on, again, the different spaces in which dietitians are at. I personally am on the preventive side. So I'm on the opposite side. So my goal is to help people to not get into some of those spaces for their health if they can, by changing their eating habits and their wellness. I really believe in empowering them to really start making healthy choices, because they want to make the best out of their life, and they have that ability by putting in the right foods, or put in the food that's going to give their body the nutrients and the nourishment to thrive and to live and to strive in life.
Right. And that starts early in life. I mean, I'm trying to be very careful about those things, and I know a lot of us are, and, just as important as we age. Let me ask you this. So you're working with a client, but the client is also working with other professionals, medical care professionals and such. What other professionals do you coordinate care with when you are in turn working with your clients?
Yes, that's a great question. It all depends on the client's needs or where they're at in regards to not just their medical health, but their emotional health. There's so many different moving pieces when it comes to a person's overall wellness. If it's something that's medical related, it's definitely teaming up with their medical doctor, getting their labs, getting their readings, kind of seeing what their health is looking like as far as on paper, and helping to appropriate the right nutrition that's going to either help lower the numbers, increase numbers in certain areas, or even just to manage the numbers. So there are times when I'm having to work with doctors and with physicians to help address some of those health issues. On the emotional piece, I actually do work a lot with clinical therapists, as far as psychologists. I work with licensed social workers. I know that it's more to than just educating someone on why does she eat an apple and not a donut. I think we all know that answer, but we don't necessarily follow through. And it's a reason why we don't follow through. So really start tapping into some of those layers that's underneath why we find ourselves, perhaps not taking care of our body the best way we can with our nutrition. It's other levels with that. And so I actually have to work, I'm actually team up. I'm part of a team when it comes to certain clients to help, not just educate them, but empower them on nutrition, help them to rectify what is it keeps them going into these negative cycles of unhealthy living, but understand that that's within my scope. And then I team up with a psychologist or with a therapist that can really address some of those other issues. So it all depends on the person, but definitely a team effort. Effort is what it takes to really help people to just be able to stand on their own and build healthy habits.
Great. Well, let's drill down a little bit. So as a general statement, then, what are some of the key nutritional things that older adults should keep in mind?
Just generally speaking, not in regards to really what's happening right now. We can definitely talk about bringing in an immunity component, but I would just create a premise of understanding when it comes to your nutrition, it's the nutrients that derive from the foods that you eat. And it's going to provide those vitamins, those minerals in a natural way that your body can glean and build its every system in this body, from our circulatory system to our nervous system to our muscular system to our skeletal system. Everything that we eat is what our body uses to work those systems. As you're aging, there are certain, just, we age, like I say, wine is finer with time. Like we age and our body, gets settled, and we also can still maintain what we have as we're aging. As far as older adults, some of the deficiencies that older adults may start facing is lower iron levels. You got to consider bone health, and you got to consider their neurological system. So most food sources that provide some of these particular vitamins, those are going to be your vitamin D for your bone health, your iron, foods that are higher in iron, and also foods that are higher in B12. And so when it comes to the elderly population, I definitely know that supplements are meant to fill in some holes that we may not get from our foods, but leaning on our food choice is really what's going to provide highly bioavailable nutrients that our body can use to address some of those deficiencies.
Do you start then with an assessment of sorts, or how do you determine, I guess, where we are, what we're doing, and how we can enhance our diets?
Well, I mean, just for objectivity, definitely, when I'm working with older clients, can't say, oh, you have a deficiency. It's probably a probability that you're leaning into those areas, but being able to have your medical records with you, that's what helps me to see where are those deficiencies. Are our iron stores low? What is our bone health looking like? And be able to address those by educating and sometimes creating, I call it nutrition programs. I don't want to call it a meal plan. Developing nutrition programs that can address some of those immediate, well, I don't want to say immediate because it takes time for these nutrients to get to working in your body. You can't just take a couple of vitamins in a few months, or even change your foods in a few months, and all of a sudden things happen. Food and nutrition heals your body. It's different than medication. It doesn't just solve a symptom or a problem, immediate problem. It heals your body. I mean, it takes time to incorporate these foods that are high in those nutrients. So your body is constantly building and growing and enhancing all the different places within it. If I know for a fact that these are deficiencies, then we incorporate foods that are high in some of those nutrients and minerals, so that clients are getting those nutrients from their foods. And hopefully the goal is that it should suffice their needs. If not, that's why we bring supplements in, and that's something that I can't prescribe how much you typically need. That's something for a doctor or pharmacist to be able to address. So again, building the team approach is what's going to help to overall help the health of that individual.
Gotcha. So you're going to come to my house and go into my pantry and find all my goodies?
I surely can if you want me to.
Let me ask you this, Reshaunda, what's the best way for someone even to get started and to find a qualified registered dietitian near them?
Well, I definitely will encourage the individual, if they are wanting to really be able to find a qualified health professional that's going to be able to address their health issues, or even just maintain healthy living and give them a proper evidence-based information, you do want to seek out a registered dietitian. There is a difference between a nutritionist and a dietitian. A lot of times we are called nutritionists, but if you ask any dietitian, they may hold their nose up to being called a nutritionist. And the reason why is because as dietitians, we have put in that education, we have put in that time and work to be that healthcare profession to address and help these particular clients and patients. So I would say definitely look for someone who has those credentials, RD, LD, and you can definitely reach. I mean, you go to the Academy of Nutrition Dietetics, which is the healthcare association, in which I'm a part of, and other dietitians. That's where you'll get a plethora of different types of dietitians. Or if you ask your physician, I would say you ask any other healthcare professional that understands the difference. They know dietitians that perhaps will be able to work with you in those spaces.
That's fantastic. Great. Thank you so much for sharing with us. I want to move on to Hedva. Hedva, what basic information should patients know about the medications that they take?
There's generally 7 to 8 pieces of information everyone should know about their medications, but I'll just highlight the most important ones. For sure, know your medications' names. The names of the medicines is so important. And remember that drugs have 2 names. They have the generic name and they have a brand name or a trade name. And that can avoid some confusion when people understand that cardizem is diltiazem, for example, that you are taking, so you know exactly which medicines you're taking, because sometimes the generics, the brand name might be switched to a generic once it's available, for example. The other thing that's really important is to know when to take the medicine. Does does 3 times a day mean you can take it with meals to make it really easy to fit into your schedule? Or do you have to schedule it more accurately every 8 hours, for example? It's really important to take the medicine so they work in with your lifestyle schedule, for example. So if we can schedule it around meal times or bedtime, it's easiest, but you need to know exactly when you need to take your medication. Another interesting point is to know how long you need to be taking it. Most medications in the older adult population are for the long term. They're chronic medicines that are treating long-term illnesses. And so you need to get the medications refilled every 30 days or 90 days once your prescription is up. Sometimes people don't realize if they need to continue the medication or not. And there are some medicines that should only be taken for a short time, be it several months or a couple years, and then you stop it. So how long do you need to take the medicine is another important question. Also to know the side effects. What are the common side effects, so you know what to expect. You can anticipate some issues and maybe how to circumvent those, how to work around and minimize those side effects. And the other piece is those more rare but serious side effects, and we don't want to talk about those, but unfortunately medications can have some more dangerous side effects. So what are those? And how do you know what to look for? What are signs or symptoms? So you know when to call your pharmacist or your doctor if something more serious might be happening. And then also if you miss a dose, that's always a common question. There's generally a standard answer for most medications that if you miss a dose, take it as soon as you remember. If it's within 2 to 3 hours of your next dose, forget it. Do not double up on your medicine. But some medications have nuances, so it's important to ask for your specific medications. So those are a handful of really good core pieces of information you should know.
Yeah, I would say, it certainly gives you a lot to think about, and I would assume for some people it just may become overwhelming, and that's why folks who do what you do are so important and play such a critical role. Let me ask you, how many times have you heard, I only take medications that my doctor tells me to take, so how can I be at risk of having a problem?
More than I like to hear. The good side of that statement is they're following the doctor's instructions. I'm only doing what my doctor tells me to take, which is wonderful. But the flip side of that is errors can happen. And there are the statistics that 1/3 of older adults will experience an adverse drug reaction, and they are much more likely to be hospitalized because of problems from their medications compared to younger patients. So errors can happen without, of course, anyone intending them to. I always say doctors never want for a problem to happen. They prescribe with the best intentions in mind, but there are lots of things that can affect the outcome of the drugs. So a couple things I'd like to explain to people is that, for one, our bodies are different. So a physician may not be aware of medications that need to have different dosages, often lower dosages as we get older, because of the way our bodies handle the medications, namely our kidney function changes and our liver function changes just because we're getting older. And not all doctors know all of the details of some of these medications. So it might be an oversight that a dose might be too high, for example. And also with older adults, we worry about which drugs are prescribed, that selection issue. There are a group of medications that are known to be more problematic in older adults, meaning the risks of side effects tend to be greater than the benefit you get from the medicine as we get older. And again, this is geriatric specialty information that not all physicians might know. So those are some issues that come from the prescribing error concern. But I also want to always talk to people about how they're taking their medicines at home, because errors can happen because we don't realize that we're doing something that's not proper. Lots of times I'm meeting with patients in their homes, and I always ask, for this medicine, how are you taking it? And more often than I would expect, there's an error in patients not reading the label. For example, the bottle says to take it twice a day, and they have only been taking it once a day. So those kinds of errors can happen at home. Patients don't realize what they are missing. taking non-prescription medications, or stretching out the drug. So adding in non-prescription drugs can cause interactions, which could lead to problems that their doctor wouldn't know about. And if the patient doesn't ask someone, no one's going to be able to identify that's a problem. And likewise, how they are taking the medicine, how they're following the instructions or not. If they're skipping doses, they want to save money, they're concerned about side effects. These things that we do at home when we take our medicine can lead to adverse and unwanted effects. So even though you're taking just what the doctor's prescribing, there's other things that can happen that you may not realize are a problem until you talk to somebody who can look at the full picture of how you're taking your medicine and in what combination, I guess.
So what are some of the things that we should be looking out for as the older adult who's taking the medication, or a family member or loved one or caregiver should be looking for that may indicate that we're not taking our medications correctly?
What are some clues? I always encourage, for sure, pill count. How many pills are left over at the end of the month? One rule of thumb I always tell people is keep your medications in the original container. So don't combine old bottles to new bottles when you get a new refill, for example. That's a way to track, are you going through the medicine as you're supposed to? If you have a 30-day supply, you should be out of medicine at 30 days. So if there's extra, or if there's not enough, that is certainly an indicator that someone is taking too much or too little. If there are a lot extra supplements, things you're taking without a prescription, those need to be added to the medication list, and make sure that the doctor or pharmacist is looking at everything someone's taking. And then other indicators of things that there might be a problem, I always talk about how you feel day to day as a big indicator of how you're doing with your medications and your health. The patient is the last link in that chain of you taking a medication, from prescribing it to having it dispensed at the pharmacy to having it at home and taking it. If you feel different, even if you've taken medicines for years, your body changes, maybe the nutrition changes. All of us on the panel have contribute to have different aspects of how wellness comes together, but it's so interrelated. So maybe there's a different health condition is going on, something new is happening, or a side effect from the medication. So things can change even though you've been on the meds for years and years. I always tell people you still want a medication review because things change in your body, and it's always good to have that double check to prevent problems.
Great. So along those lines, if someone really wants to be smart about taking medications to reduce risk and stay well, where's a good place for them to start?
Well, number one, avoid medications whenever possible. So I always talk, just a quick topic, I hope we can talk a little bit more about this, is the non-drug strategies to stay healthy. Take care of your body, exercise, diet, don't smoke, limit alcohol. All those healthy things are really important. But when you need the medications, always have a complete medication list. And I always talk to people about three types of medications that need to be on that list. Your prescription drugs, your OTC, over-the-counter drugs like your antihistamines or vitamins or antacid medications or pain medications, as well as the dietary supplements. So all types of medications need to be on that list. So that's number one complete medicine list. And also use one pharmacy. Get to know the pharmacist there. We have so much information to help you choose as Reshaunda had mentioned, to choose a dietary supplement, to know how much vitamin is appropriate. So use one pharmacy and get to know that pharmacist so that relationship can develop, and the pharmacist can then notice a change and help you understand what's going on with your medicine. Follow the instructions. Take what the doctor says, but read the label every time you take your medication, and we call it medication adherence. So take the medicines as instructed. If you have issues, be honest with your doctor and let your doctor know, I'm not taking it because I'm worried about side effects or it's expensive or whatever it might be. And the last piece I'd throw out to people is, do not take a non-prescription, a dietary supplement, or even add a new prescription without talking to your pharmacist. Again, we're a wealth of information. Full disclaimer, I'm a pharmacist. I believe in the knowledge we have, and people don't know what they don't know about the medicines they take. So always ask. When you're at the pharmacy counter, say yes when someone says, do you have any questions for the pharmacist? It's my new campaign. I just want people to talk to their pharmacist and ask to make sure they know all they need to know about the drugs they take.
You had mentioned something about non-prescription drugs and dietary supplements, and just, I guess, all FDA approved drugs in general. I mean, how do we know whether they're safe or whether they're not safe? And I guess, oftentimes we're depending on our pharmacies to maybe notice that we're taking two things together that we shouldn't be taking. But what about some of those non-prescription drugs and dietary supplements that are not as regulated? How do we get our arms around all those and how they're going to interact with one another?
I think it's a good point to bring up for everyone to understand how these different drug classes or groups of drugs are regulated. So with the approved prescription medicines, they've gone through rigorous studies to prove they are safe and effective for use. But it doesn't mean that they are going to be safe and effective 100% in all situations. So there are many medications where they're effective in most of the patients, but not everybody. And an example here, just to help people understand, the drugs for treating dementia or Alzheimer's disease, for example, they're effective in a portion of patients, maybe 60%, 70%, but certainly there's going to be a percentage of patients who will not respond to these medications. So people need to understand that effectiveness these drugs are very effective, but not 100% in every situation. And likewise with the side effects, there's always side effects. We're all familiar with that long list we get from the pharmacy when we pick up a prescription of all the side effects. So we have to be aware of the risks of medications. But by and large, there are always studies to support safety and effectiveness of these meds before they can be prescribed. With the dietary supplements, totally at the other opposite side. These products are not regulated as drugs at all. They're viewed as foods by the government. So any manufacturer can put out a supplement on the shelf and have it and sell it. It is the responsibility of the FDA, the Food and Drug Administration, to identify a dietary supplement is unsafe or unsafe. They don't look at the efficacy. But if it's unsafe, they'll pull it from the market. So it's a reverse process. So what's on the shelf, it's a buyer beware situation with a dietary supplement. So I always encourage people, purchase your supplements at your pharmacy, someplace you can trust. Talk to the pharmacist about what is the best reliable supplement and what supplement they trust. Look for a approval mark on the package that this has been good manufacturing practices and expiration date and things like that. So we need to be aware that dietary supplements, although many can be helpful, they're not studied. We don't know that they're safe necessarily. We don't know that they're effective. Although there are some studies being done. So for example, St. John's wort has been studied for mild depression, as an example. So be cautious, buyer beware, and that's why I always encourage patients, talk to your pharmacist when you're selecting a dietary supplement. And that last category, real quick, is the over-the-counter drugs, the OTCs. And these products are not necessarily approved by the FDA either, but the manufacturers of dietary supplements have essentially an ingredient list from which they can choose that have been approved by the FDA. And these manufacturers can then combine and formulate those ingredients into an OTC product that can be marketed. So we have some level of safety of the and effectiveness of the OTCs, like your antacids or Tylenol, for example, these types of products. But in the same vein, there's too long to describe here, but there's a process going on over the last 20 years where the government is looking at over-the-counter ingredients and removing ones that are found to be ineffective or unsafe. So kind of a little wandering answer, but our prescription medicines you can have a lot of faith in, but be aware that there can be risks with them. The OTCs, good solid support that these are generally going to be okay for you to use, but they can have interactions and side effects. And then with the dietary supplements, it's a buyer beware market because they're not regulated as drugs at all.
You asked about what signs you can look out for if there's a problem. And one of them that I find with a lot of my patients, it's one of the top 3 signs or causes of dementia symptoms is polypharmacy, which means taking too many prescriptions. So the family is what will notice that before the patient will. A lot of them have more than one doctor, and a lot of them are connected with their electronic medical records. So a lot of them will know before it's even mentioned that they have other prescriptions. But if they see this doctor 3 times a year, they may forget to update their doctor. So if they get in the habit of reminding their doctor what prescriptions they're on, it will decrease the chances of bad interactions.
And also got to keep in mind too, a lot of these OTC or over-the-counter medications or drugs used to be prescription drugs. So they're not always lightweight things, even though you can buy them over the counter and don't need a prescription for them. So Hedva, thank you for that information. Appreciate that. And Krista, we're going to move on to you and talk about the feet. And I'd like to talk in regard to about some of the more common foot issues that you come across as a board certified foot care nurse.
Well, I'd say the most common one is just general foot pain, not understanding what's causing their pain. And a lot of times they can have pronation or supination, which means that the ankle is twisting in or out, which can change your entire gait, the way that you walk, which can cause knee pain, back pain, even neck pain. So that and thick nails are the top 2 things that I come across. It's very easy to create an orthotic. I don't believe in those very expensive orthotics. It's very easy to modify something or modify the shoe so that they aren't getting pressure put on a certain part of the foot that's causing them pain. If you look at a baby's foot, there's a very large fat pad on the bottom of it. And as we get older, it's kind of like a woman rolling out a pie crust over and over and over again. It gets so thin, it's like walking on your knuckles. So then the pain underneath any bony prominence can cause a callus, and then underneath that they can get a pressure ulcer, which can actually lead to amputation. So those are the top things that I really come across. And when I do treat thick nails, I thin them first so that they're more comfortable in their shoe, and then I trim them as well.
I keep hearing about neuropathy. It's something that I've seen firsthand with a loved one. And I talked to somebody the other day who's got diabetes, who said that he has neuropathy as well, and that's why he's not walking as well as he used to. Talk to us a little bit about that and an indication that you actually might have it.
Well, there's lots of different ways that neuropathy can present itself. I describe it as prank calls or a deadline. So if somebody has numbness, they could stub their foot on a cabinet in the bathroom and break their toe and not even realize they've done it, especially if they have poor vision. I've actually had patients say, I think I've got a fingernail or toenail that's snagging, but it's their toe is totally to the side and getting stuck on their sock. So that's one way it can present. It can also present as feeling of ice cold, burning hot, or pins and needles. So the way I treat it is to distract the brain. The brain can only pay attention to so many things. It's like whenever you get lost when you're driving, you turn down the radio. That has nothing to do with what you're seeing or where you know where you're going, but the brain can only process so much. So if the patient has a burning hot sensation, then I suggest something that has a high concentration of menthol, because the brain will pay attention to that over the prank calls that it's getting. Does that make sense?
Yeah, it does.
And then with the numbness, it's extremely important that even at night when they go to the bathroom, they do not walk barefooted, because that can lead to an injury that could cause an amputation later. And my father-in-law, he had a rock in his foot for 3 days and didn't know it. I've had patients with Legos in their foot. They're just, they don't know. So it's really important to get in the habit of looking at it. And if you can't see the bottom of your foot, just take up a hand bathroom mirror and check underneath it for redness or any foreign objects, or having a loved one looking at it. But it needs to be a habit that's done every single day, because you want to catch it before it turns into an infection.
Right. And then I also know that it could impact one's ability to drive, whether accelerate or brake. So those are things that we need to look out for. What about plantar fasciitis? I keep hearing about that. And can anything be done about it?
Yes, it's a physical therapy. A physical therapist actually taught me about it. I came into knowledge about this because mine was so bad it actually broke the heel of my bone away where it attaches. So what it is if you imagine a wall in your home, you have a substructure, which is your 2x4s and your drywall, and that's what's supposed to hold your arch in place. And then the fascia is kind of like the wallpaper. Well, we are not intended to wear shoes, and most shoes have arch support, which causes the muscles to break down or atrophy. So then you're left with the wallpaper holding up the whole wall. So whenever it's stretching, where it's attached at the ball of the foot and at the heel, and that's typically where the pain is. So, and it's a sharp pain, and it's typically pain that's worse when you first stand up on it. Even if it's just driving in your car for a few minutes, it can only take 5 minutes for the pressure to build back up in it. We have these little substructures that look kind of like a gel-filled vitamin, and that is what causes it gives you some cushioning between the ligaments and tendons in the foot and the bone. So whenever there's trauma, those swell. And then when you step on them, it feels like broken glass because you're actually rupturing those little cells again. So if you can imagine making a fist with your foot as hard as you can 3 times, that forces out some of that inflammation so that when they step down, it doesn't feel like they're stepping on glass because they're not causing more trauma. The majority of the orthopedic surgeons I've talked to have said to do stretches, which is the worst thing that you can do because it's actually causing more trauma. It feels good. It's a weird feel good. I don't know really how to explain it, but it's causing more trauma that your foot has to heal from. So you have to protect that arch while it's healing. So you want to wear arch supports at that point at all times. And then there's an exercise that you do. I call it the flamingo. I don't know what the physical therapists call it, but you stand in front of a counter and you want to have it within reach just for stability, but you want to let go of it just a few inches ahead, and you lift up one leg like a flamingo, and this is the only time you don't wear shoes during this whole healing process. And you'll feel your foot wobbling, and that's all those weak muscles exercising, and it very quickly will reestablish the strength needed to hold that arch in place the way that it's supposed to. And whenever that substructure is holding the arch in place, it takes the pressure off of the fascia, so the fascia can just be there covering. Whenever you cook beef or chicken, it's that pearly, really thin covering of the meat. That's fascia. So if you can imagine something that thin trying to hold your arch in place, you can see automatically why it would be a problem. So it takes less than a couple of weeks for this, and you don't have to get those painful injections. It's just and then whenever you start to feel that pain again in the future, just start to do the exercise again, and it turns right around usually within a day or 2.
Why is it common for our nails to get thicker as we age?
It's typically a fungal infection. And again, we were not intended to wear shoes. So we're putting our feet, which are, they're sweaty, and we're putting them in this dark environment that doesn't have much air, and it creates the ripe environment for fungal infection. Yeast can cause a problem too. But people who wear Birkenstocks and open-toed shoes, they don't ever get fungal infections, and that's the only reason why. There are pills that you can take, but it can kill your liver. So I never think it's worth that. And then the other things, well, there's lots of over-the-counter things, but the thing I found that works the best is Listerine. And I know that sounds silly, but I'll explain why it works. Listerine was originally created as a surgical disinfectant, and it has something called thymol in it. And thymol is what organic farmers use to kill fungus on their crops. And that's why it keeps the amount of fungus on the toes down to a manageable amount. We always have fungus, yeast, virus, and bacteria living on our body. And if you think about one of the world wars, when one of them gets stronger, that's when they invade. So we have to keep them all at a manageable amount. And by spritzing it with Listerine, use yellow because the blue and the green will stain. It keeps it at a manageable amount so that it doesn't do an invasion. Now, the great toenail takes a full year to grow out, so you have to be patient with it, and you have to do it once a day, but it doesn't have to dry before you put your shoes on, but it must be thinned first because the fungus makes the toenail porous, so it absorbs bathtub water and foot sweat, and then that, just like in your bathroom, it's the perfect environment for that type of infection. So it must be thinned, then you spritz it with Listerine, and then you'll notice in about 3 months a very clear window coming up. Once it's totally healed, you do it once a week, and then that keeps the infection from reinvading. There's one more thing I wanted to mention was a lot of doctors are surgery happy for hammer toes, bunions. I mean, they just love to restructure the bones of the feet. And I have not once seen that go well. First of all, they haven't really followed suit with physical therapy and rehab the way that most other surgeons do. So the patients often will they start out with their toes curved the way it should be, and then all of a sudden one ligament or tendon will get tight, and then their toe will pop up, and then it creates a whole other situation. There are a lot of over-the-counter, not supplements, but orthotics that you can even get at Walmart that can help you avoid surgery. In fact, I haven't seen a patient yet in 6 years that has needed surgery.
Well, great. Thank you for that advice. And that leads perfectly into Beth, and you had mentioned physical therapy. So Beth, you do in-home physical therapy. You also have a studio, and you specialize in working with older adults. Tell us, what does a physical therapist or PT do?
Yeah, well, it's interesting what people think we do and then what we actually do. So our practice, we just really specialize in helping folks stay active and independent. We work only with folks 55 and older. And so they're planning for retirement, or they're trying to enjoy retirement, planning on travel and doing trips with the grandkids and getting out in the garden and doing all their hobbies. And so we just help people do that, because as you get older, aches and pains sneak up, you start to get a little bit of weakness, or you might start to feel a little bit more unsteady on your feet. And when you don't address those issues, it can prohibit you from living the retirement that you planned, that you dreamed for, that you saved for. So we just really help people live a full and high quality life and keep doing the things that they love to do.
Yeah, and we're all looking forward to retirement. We want to make sure that we can actually do those things. So when it comes to physical therapy in general, is that something that has to be prescribed by a medical doctor?
Yes, so we still require a prescription for traditional physical therapy. But at HouseFit, we also really focus a lot on wellness and prevention. We offer group exercise classes, which we're doing online right now. We hope to add group training back into the facility by the end of the summer. And if you're looking at just exercise and wellness, that doesn't require a physical therapy prescription from a doctor. But if you're looking for traditional one-on-one therapy, then yes, we do require a doctor's prescription, but that's something that we help our folks secure.
Right. And if you have a doctor's prescription, I'm assuming insurance or Medicare will cover part, if not all, of what you do?
Yeah, so we're an out-of-network clinic, but Medicare is hands down our best reimburser, and our folks get the best coverage with traditional Medicare.
Right. I've had conversations with seniors who are having balance issues and things along those lines, and I can't quite seem to get the message across that Medicare is going to pay for your physical therapy that's going to help prevent the fall that's going to end up breaking your hip or breaking your head. I don't know. Am I missing something there?
No, I mean, we talk to people every single day who don't realize that physical therapy is even an option to help improve your balance. There are so many folks who just believe that losing their balance and falling is a normal part of aging. So they accept it and they really don't seek out other solutions or options to reverse that process, when in fact, proper exercise and strengthening can make a huge impact and significantly decrease your fall rate.
Right. And I know you do a great job in helping folks get past some of the myths about exercising late in life. And you and I talked through this a little bit, and we came up with a list of statements to discuss fact versus fiction. So I'm going to give a couple different statements for you, and we'd love to get some feedback from you in regard to whether these are true or not true. First one is, I'm too old to start exercising.
That is, of course, false. There is plenty of research out there that even into your 70s, 80s, and 90s, you can improve your strength, improve your endurance, and improve your balance. Age really is just a number when it comes to your physical fitness. And so part of it is finding the right clinician or the right person to work with who also has that same belief set that will challenge you appropriately so that you can see the improvements that you're looking for. But age in itself is not a good reason to not start exercising.
It just sounds like a pretty good excuse though, right?
It is.
So
a common one, not a good one.
I know. So I'm a walker. I walk normally every day. I walk about 6 miles a day, 3 in the morning, 3 in the afternoon. Is that all the
fabulous.
exercise? Yeah, thanks. But is that all the exercise I need?
No, and exercise or walking is a great exercise. It's oftentimes one of the first things we start our folks on is a simple walking program. But walking doesn't cover all the bases. When we look at your physical fitness, we look at your balance, your strength, your posture, your flexibility, and your endurance. And walking definitely works on your endurance, but it doesn't specifically address strength. It doesn't specifically address posture and balance. And so it's a great start, but it doesn't cover the whole picture.
Now you're bursting my bubble.
I'm sorry.
One of the other myths that's out there is that I should stay away from lifting heavy weights. True? False?
That is false. And if you think of your day-to-day life, like a gallon of milk weighs 8 pounds. The big bulk laundry detergents that you get at Sam's or Costco, they're 12 pounds. Pushing your garbage canister out to the curb or pulling it back in, that's heavy weight. A full load of laundry can weigh up to 16 pounds, and then you have to carry that up and down the stairs. So many people have pets and grandbabies and toddlers. My toddler's 40 pounds, but if she passes out on the couch, I still need to pick her up and carry her upstairs. So in our day-to-day lives, we lift, we carry, we push, and we pull heavy things all the time. And as you get weaker, you're actually more at risk for injuring yourself doing a normal thing. Actually, one of our clients moved his plantars. He moves them in and out every year. But within the course of a year, he had gotten so much weaker that moving the same planter that he moved last year, he injured his back because he had gotten weaker over the course of the time. So strength training is a hugely important aspect of staying healthy as you age.
What about folks with arthritis? Because oftentimes folks will say that if they exercise and they have arthritis, it'll make the arthritis worse.
Yeah, and we find that all the time. And I agree that doing the wrong types of exercise can absolutely flare up your arthritis. And oftentimes people are just like, I'm going to exercise, and they start too quickly. So whether it's the wrong style or being overzealous and just jumping all in without doing proper warm-ups, we do run into that. But we also know when you go to the Arthritis Foundation, their website, one of the number one things they recommend is exercise. And so finding the right type of exercise, here at House Fit, we offer the Tai Chi for Arthritis program, which is supported by the CDC and the Arthritis Foundation as safe and effective exercise. And it's gentle and it's mild, so it doesn't put a lot of stress on the joints, but it actually improves the strength around the joints. And the outcomes are phenomenal. So it's all about finding the right type of exercise and making sure that you have an appropriate warm-up before you do anything too intense.
Some of my clients have had balance issues, and it's obvious to me as a layperson just because I'm watching them get up and they're kind of surfing between the couch and the table and another handrail in order to get to where they need to go. So can the idea of balance being too bad be a good excuse for not exercising?
Yeah, and so if your balance is really bad, a group exercise class may not be the best starting place, but one-on-one physical therapy is a great thing. We can create a custom program for you. A lot of times it's a strength issue. We lose a lot of strength in our hips and our ankles, and that contributes to balance issues. So just starting on a simple strengthening program, layering in balance challenges. Oftentimes as we age, we don't move around as much as we used to, so our reflexes aren't as quick for catching ourselves. We lose the strength. We don't move side to side anymore. So in physical therapy, a lot of times we'll challenge folks, but we've also created some exercise classes that are based on some really great studies showing that you can reduce your fall risk by 33% just by exercising 3 days a week. So exercise is one of the single best things you can do to improve your balance. It just depends on whether you need one-on-one instruction first or whether you're really ready for that group setting.
And one of the best things I ever did, this goes back probably 3 years ago, is to get a prescription for physical therapy. I went to one person and that person was okay, but then I went to another person who helped me with my back. And within a matter of, I'd say 3 months, 2 times a week, completely changed my world. And it's been 3 or 4 years since I've seen that person, I believe. And I still sing his praises every day because I haven't had a back issue since. So really, seeking out physical therapy and the right physical therapist for you, whoever that ends up being, can make all the difference in the world. And I don't know, we just got our physical therapist in the family, so he's going to be my best friend, I think. Let me ask you one other question, and then we're going to wrap it up. So if we have health conditions that we're concerned about and whether exercise is actually in our best interest, do you coordinate with other healthcare providers, and how do you best determine whether it's safe for me to actually go out and do the things that you're going to want me to do?
Yeah, absolutely. So when we see our folks, because we do work with a higher risk population, we check vitals, we check blood pressure and heart rate every time to make sure you're safe to exercise. And when we see folks twice a week, we're often the ones to identify the arrhythmias, the hypertensive episodes, or on the flip side, the low blood pressure. We call the doctors and we coordinate with them when it's appropriate and necessary. We're often some ones that identify medication errors when we talk to them about their pain meds and how they're using them. Again, we're an advocate for them. We direct them back to the physician. There's really not a single medical diagnosis out there that doesn't benefit from some kind of exercise. But the knowledge of a physical therapist, we can really monitor the medical side of it as well to make sure that you are exercising it in a safe way, as to not flare up your medical issue, as to protect you and just help you get stronger and healthier.
So we're at the point right now where I think we're going to wrap it up. But before we do that, panelists, any final thoughts?
This whole panel, like I started off, it's phenomenal. All our specialties come together for that wellness piece. When I'm doing my work, I'm referring to a dietitian. The diet is so important. I'm referring to physical therapists because of all the benefits that Beth described. I'm talking about the neuropathy that Krista touched on is so important. The pronation, the supination, how that can affect the pain in their body, so we can eliminate medications. It's so interrelated, and I love that all of us are together talking about this. But medications are just a piece of it. It's the overall wellness. As I mentioned quickly before, the diet, the physical activity, the non-smoking, getting enough sleep, limiting your alcohol, these healthy behaviors it's the package, I believe, as we get older, to minimize problems.
We're going to have all of our great panelists' contact information at the end, so feel free to take a look at that. And if you are not viewing this but listening to this and you need additional information or contact information for our panelists, just contact me and I will put you in touch with them. And again, panelists, thank you so much for sharing with us today. The next topic in our seminar series is in-home care. Keeping in mind that these seminars were originally intended to be in person, and unfortunately, due to the COVID-19 issues, we have not been able to do these in person, so we've modified them to be available online. We will be hosting these and having these panels again in person as soon as possible. So if you want to attend this particular panel, it's probably going to be in June of 2021. Because right now we're recording in June of 2020. Next topic in the seminar series is going to be in-home care, and our panelists will include experts in companion and skilled care in the home, care management, and technology. We also would like to suggest that you check out our website for links to other seminars that we have recorded prior to this and for future seminars. And there will also be links to our podcast if you prefer to listen to these versus watch them. And you can find all of that on the seniorlearninginstitute.com website. And finally, I want to thank the following progressive and caring sponsors for the Senior Learning Institute. These folks have decided to really step up and help us fund these live events. And I want to make sure that we make mention to them virtually as well. So those include Friendship Village in Sunset Hills in Chesterfield, One-on-One Mobility in St. Louis, the East Step Law Firm, Drew Ishmael at Edward Jones, Right at Home, St. Louis, Assistance Home Care, Oasis Senior Advisors in Chesterfield, Missouri, Lasting Impressions Home Remodeling, Shrupp Senior Services, their Medicare specialists, Quest Care Care Management, 360 Caliber Quality Care and Transport Services, Mr. Dennis Cooper at the Federal Savings Bank, the Reverse Mortgage Specialist, and Eureka Contracting and Roofing, and then myself, Team Ted Real Estate.